Right. Good morning, everyone, and thank you so much for joining us this morning in our September Eggheads webinar series. We are talking today about housekeeping items before we get started. We are going to save a lot of time for questions and conversation at the end with this topic especially. This is a new world for a lot of us, and what you'll see today is a webinar set up to generate discussion. So we really want to hear what your thoughts are, your concerns, your questions are. So we'll have plenty of time for that in the end. You can drop questions in either the chat or the Q&A function. We'll be looking at both of those. Well, my name is Joe Hannell. I am Communications Director here at Colorado Health Institute. And it's my pleasure to get us going, tell you a little bit about CHI. We're a nonprofit, mission-driven research and consulting group. We're a public health institute. We advance equity and well-being in our communities through expertise and knowing how to get things done in the policy space. We've been working with community groups and government agencies and foundations and many others for our founding more than 20 years ago. And we also have a public-facing portfolio of work that's funded by foundations. And what we're participating in today is Eggheads webinar. That's part of that. If you'd like to learn more about CHI's work, please reach out to any of us here. Now, I'm thrilled to introduce our speakers this morning. First, I'll turn it over to my colleague sitting right next to me, Rachel Boyer, research analyst here at CHI, and she's going to set the stage with some kind of framing of how we could be thinking about AI in the health space. Next, Rachel will pass it over to our newest colleague, Nina Bianchi, a director who has some extensive experience working in AI in her previous job with federal government. And then finally, we'll turn it over to Dr. Matt Wynea, longtime friend of CHI and head of the CU Center for Bioethics and Humanities, where he has been wrestling with some of these implications of AI recently. So with that, I'm going to slide this computer over in a very high-tech way to my colleague, Rachel.
Okay. Woohoo. Thank you so much, Joe. I am really excited to be able to talk to you all today about this emerging issue, which is AI in healthcare. So let me give you a little bit of an outline of what I'm going to talk about today before I pass it over to our other speakers. So first, I want to talk about why we think AI is really going to grow in healthcare. You know, what is it about the healthcare space that makes it so ripe for disruption with AI? Then I want to give you some examples of how AI is being used in healthcare currently, just to kind of make it concrete, and so you can see what has been done and is being in development right now. And then I also want to talk about how we can improve community engagement in the AI process and really think about how to be really intentional about the way that we adopt AI into our systems. So first of all, I want to make sure that we are on the same page when it comes to AI. I think a lot of us are familiar with tools that have really risen to prominence in recent times, such as ChatGPT. But really, AI is kind of a more general suite of tools than, just kind of like the ChatGPT language-based models. So defining AI, I think, could really be its own webinar and webinar series itself. So we're not going to be able to fully define it today, but I think one definition that we can rely on today, provided by IBM, is that artificial intelligence leverages computers and machines to mimic the problem-solving and decision-making capabilities of the human mind. So, meaning AI is a tool that is meant to mimic things that humans are already capable of. I think one really important thing not to lose track of, like in discussions about AI, is that humans made AI, right? So it's very much a human-driven process. And I mentioned that just because I want to emphasize that people are responsible for key parts of the AI adoption process. Everything from creation to implementation. And AI is not neutral, right? It's not objective. It reflects our assumptions, biases, and values. So I think that's a really important thing to keep in mind when we start talking about these advanced AI tools. So let's get into why I think that AI is really going to grow in healthcare. So first of all, there is sky-high demand for healthcare. I think we're all familiar with this in some shape or form, especially coming out of the COVID-19 pandemic. There is just a huge increase for mental health care, for example. Providers are overloaded. There's long wait times for specialists. There's a big demand on our system. If AI can help kind of alleviate that demand in any way, it's certainly going to be welcome. Another big kind of potential of AI, more so than other tools that have come before it, is really its potential for having great predictive power. And there's a lot of ways that we could think about how this could be useful in the realms of diagnosis and prevention specifically. If we think of a patient, coming to an ER with like abdominal pain, there's really so many things that could be. And it's up to providers and care teams to get to an answer quickly. And if AI can help them in that process, that would certainly be a welcome development. And finally, another point I want to emphasize today is that healthcare is a really rich data environment. And AI has the potential to really utilize all this data that we've been collecting in healthcare to its fullest potential. And let me kind of dig into that point and expand upon it. So what do I mean when I'm talking about the rich healthcare data environment? Well, first of all, I think we all are familiar with the fact that healthcare is a huge big data field, meaning that on a daily basis, there's just a huge volume of data that is being collected about all aspects of health and healthcare. So for example, we can think about population health data and all the information that exists about, the rates of COVID in the community or the rates of STIs, right? We can think about the other side of healthcare as well and think about billing and just the sheer amount of insurance claims that are generated on a yearly or daily basis to really support the billing and reimbursement and kind of payment side of healthcare. And generally speaking, AI learns by processing data, and it kind of depends on the tool you're using, but you can think of a general rule as the more data you have and the more complete your data is, the better your AI algorithm is going to perform. So the fact that healthcare is so rich in data, it could, be a good place that the AI could operate relatively well. AI also has the potential to really help synthesize this huge amount of data and make sure that important trends and findings in this kind of huge river of data are discovered and not missed. Another element of the healthcare data infrastructure is that there's a lot of unstructured data from multiple sources. And this really creates barriers a lot of times for care teams and for administrators. You can think of the way electronic health records are stored. If you think of what is all in an electronic health record, there's anything from like doctor's notes to visit information to medical imaging. And you can also think about the fact that there's lots of different electronic health record software out there that store data in all types of different shapes and fashions. And I mentioned this just because more so than other tools before it, AI has great synthesis and organization potential that could really take these disparate data sources and make an easy to understand summary, which could really help maintain the continuity of someone's care. And finally, the last kind of element about the healthcare data environment that I wanted to emphasize is that there is some real-time data that's collected, meaning data that is most important and relevant at the time of collection. Examples of this could include vital signs or wearable health monitors. And the potential for AI to have really fast processing speed and really integration into like our existing systems could really aid care teams in noticing important changes and providing expedient care. So these are all kind of examples of the, potential that AI could really use to be beneficial to the system, the healthcare system. So to make it a little bit concrete, I wanted to just briefly touch on a couple examples of how AI is being used in healthcare today. So Dr. Regina Barzilay at MIT has developed an AI program that can read mammogram images and determine if a patient is high risk for breast cancer. And this is kind of an example of kind of the prevention and diagnostic capabilities of AI. And in the tests of this particular algorithm, they found that it was correct at determining if a patient was high risk for cancer about 76% of the time. And it's important to note that a tool like this does not replace any of the kind of traditional routes that we have for breast cancer care, but it could, in the future, potentially help patients make decisions about preventative screening and potentially lifestyle changes. Another example more on kind of the administrative side of healthcare is that there are many companies that are offering what is called a medical scribe. And so what this medical scribe AI is able to do is take a recording of a patient and provider visit and write the doctor's notes. Not only kind of the medical summaries, but also write up billing codes based on what was said in the visit. Anecdotally, tools like this have been able to reduce the time the doctors spend on notes from 2 hours to just 20 minutes. And the tools are very much in the stage where they need to be used selectively on visits and also reviewed by doctors. But the potential for the tool to really reduce the admin burden on doctors means that they could potentially spend more time with patients and more time kind of providing care rather than focusing on documentation. So I want to kind of switch what I'm talking about a little bit to thinking about values in AI. I think that a lot of times we are used to talking about AI in terms of its capability and its efficiency, but those aren't really, true values, right? Like I mentioned earlier, AI is a human creation, which means that it should reflect, what we are trying to accomplish with our values and the goals derived from those values. So, for example, AI should be used as a tool to advance health equity, right? Not simply to maintain the status quo. We want to improve the quality of care and improve the reach of, who gets quality care. So along those lines, I think another really important thing to think about, like in terms of AI and how we are going to adopt it, is how we can really bring community to the table. And so I want to spend the rest of my time presenting before I pass it over to our speakers, talking a little bit about how to involve, the benefits of involving community in this AI process. So the first thing when I think about when trying to adopt AI in a responsible manner is how can we involve community and what are the potential benefits of involving the community? So the first thing I think about is co-creation, which means involving people early on in the process while the AI is being developed, not simply, after it's being developed and determining like where it's going to be used. So how could this kind of help us? Well, like I mentioned before, AI is not neutral or objective. It reflects our assumptions and biases. And a lot of those biases come from our data collection systems. Remember, AI really thrives and grows on rich data environments. And so, if our data collection processes are incomplete, or if they do not reflect the populations that the AI is going to be used on, then you're certainly going to end up with undesirable results that could be very biased. So I think involving community early in this process can really help address these upstream issues of incomplete data collection, unrepresentative training sets that are used to teach AI, and really potentially mitigate bias that arises from that particular issue. Another thing to think about, kind of more downstream than the co-creation of AI, is the implementation of AI, right? I think in recent years, we've seen a lot of tech products that are not transparent at all in the way that they operate and collect data, which I think is not a good mold for AI in healthcare to follow. So I think increasing community decision-making in the AI adoption process is really critical for increasing transparency, which provides a lot of benefits. I think also community involvement in the adoption of AI into the healthcare system is really critical in determining where AI assistance is appropriate. If we think about healthcare, there's a lot of really important relationships in healthcare that where trust is a key factor, including between providers and patients. And I think the kind of quick adoption of AI has the potential to really threaten that trust. So I think it's important to talk with people who are going to be impacted by this technology about, where they think it's appropriate to use in their healthcare. And finally, I think it's really important to get community leadership and involvement in addressing issues of privacy and consent. It's hard to imagine developing good policies for that without the people at the table who are most impacted. And I will also say that in all the things that I mentioned, legislation and policy play a really critical role as well in kind of protecting, certain rights that people should have around privacy and consent. And my colleague Nina Bianchi is going to kind of talk more to what we're seeing at the federal level develop around that issue, specifically of privacy and consent, and kind of the whole spectrum of how to adopt AI in a responsible manner. So I hope that gives you some kind of framework to start thinking about, both kind of some basic facts about AI and like what about the healthcare system is really going to make it grow, and also raises up some questions about how to do a better job of involving community in the adoption process. And with that, I will go ahead and pass it over to our next speaker, Nina Bianchi, to kind of tell us a little bit about the federal landscape that's developing on this issue.
Thank you so much, Rachel. That was an incredible overview. I'm so excited to be here. Good morning, everyone. So for those that are watching, we appreciate the incredible graphics, Rachel. It feels like I'm on C-SPAN this morning, which is amazing. It's a great way to start a Thursday. So there's a lot of emerging policy and questions around what AI is. And we're really diving into how we might ensure the development is equitable and inclusive, and really thinking about what's the future of more adaptive and responsive policymaking. And I want to underscore something Rachel mentioned. The more inclusive we are in the development, the less likely we're to see bias downstream in the automation. So you might be wondering, why do I know about this? I'm here at CHI. So I spent a good bit of time at the federal level, and I had the honor of serving on what was the Cancer Moonshot 1.0, and really focusing on how AI is going to help in cancer therapies and cancer clinical trial matching. So I've done hundreds of listening sessions with stakeholders in industry, research spaces, and across HHS. So this data is sort of baked into my own AI, and I'm excited to have this conversation today. So just quickly an outline, I'm going to drop 4 big areas that are happening in the federal space. And then Dr. Winia is going to take us and get into some more details with use cases, but it's important to be aware of what's happening at the federal space. All right, so the first one I'm going to dive into is the AI Bill of Rights. So this was published by the White House, specifically in the Office of Science and Technology Policy in October of 2022. So it outlines principles and practices to safeguard the rights of the American public. So imagine these popping up on screen if I had the cool C-SPAN graphics going on today. So safety and effectiveness. Automated systems must be developed and tested with diverse input. Protection against algorithmic discrimination. Data privacy. Notice and explanation. So specifically clear notice. What does clear mean? And explanations of system usage should be provided to all users. Human alternatives and remedies. So access, is it our right to access human alternatives when automated systems fail or produce errors, especially in areas like criminal justice and healthcare? This Bill of Rights also encourages public reporting on principles to ensure transparency and accountability in AI systems. I know that's a lot of information, so my colleague Joe is going to drop links in the chat So you all can follow up and read more about this after you get off the webinar today. The second is the TAG Act. So TAG is a bill, and it is short for the Transparent Automated Governance Act, or TAG Act. And this was introduced in the Senate on June 7th in 2023. And it's starting to get deeper into defining various terms related to automated systems and critical decisions, such as augmented critical decision process and augmented automated system. It also outlines criteria of guidance, including plain language, notices, appeals, processes, and other criteria for tracking issues related to automated systems. All right, and thank you for dropping those links in the chat. The third is the Create AI Act. This is really exciting. It's getting a lot of press. A lot of thought leaders in AI from different institutions across the nation have been advising Congress on this. And Create AI is short for creating resources for every American to experiment with artificial intelligence. And this was dropped July 28th, 2023, so pretty new as well. And it's really seeking to establish a national artificial intelligence research resource and really bringing a center point for research infrastructure that provides AI researchers and students from diverse backgrounds more access to the complex resources, data, and tools which Rachel is starting to introduce that's really needed to develop safe and trustworthy AI. And the fourth area, specific to healthcare, the HHS Trust Playbook. So this is very specific to healthcare, of course, and it's a playbook, so it's a little more actionable than just straight up policy. And this was introduced a few years ago, so September 2021, but it's worth noting because it deep dives into principles for AI adoption, which Rachel mentioned earlier, in healthcare and public health context. It also provides pretty significantly detailed use cases across various stages of the AI lifecycle. And I recommend checking out because it's a good example of how HHS, so Health and Human Services from a federal standpoint, is really looking at the application at a more detailed way. All right. I'm going to pass this over to Dr. Winia, who's going to dive into more specific use case today. So I am excited to have this conversation with you all today.
Thanks so much, Nina. That's been a wonderful opening. I am reminded of two quotes just to get us started. And I'm not going to get the quotes right, but Bill Gates, I think, has said, it is human nature to overestimate how quickly things are going to change in the next 2 years, but to underestimate how much they're going to change in the next 10 years. And I think we've been in that space for a long time with artificial intelligence. The prospect of, rapid development and change and implementation in healthcare has felt like it's right around the corner for the last 10 years. And then in the last 6 months, it has just skyrocketed, which is what the second quote that I was thinking of. There's an economist whose name I don't remember, but he sort of famously said, things take longer to happen than you think they will, and then they happen much faster than you can imagine. And that feels like where we are in the AI in healthcare space right now. And I could be wrong. Maybe this is just the hype cycle. But just yesterday, JAMA dropped an interview with Mike Howell, Google's chief clinical officer, and Kirsten Bibbins Domingo, the editor of JAMA, was talking to him about this. He points to AI in the last year as being equivalent to the invention or the discovery of penicillin. That it will be that disruptive in a very short period of time from here. And the example he gave, and of course he's from Google, so he's going to say that, right? But he did have a couple of data points that I thought were interesting. And you've probably heard these stories because they've been widely reported in the news, but he did inform me of something that I was unaware of previously. Their medical AI tool took the took medical licensing exam for the first time in December of 2022. And they reported this, and this is what you've probably heard. It passed. in December of 2022. It passed with a score of 67%, which is pretty good. It's not terrible. And in May, just a few months later, 5 months later, they took it again, and it scored 87%. So then they took it and asked it real questions that people have asked about medical care on Google. Like, how do you treat rosacea? Is there a cure for incontinence? I'm having a headache. Do I need, right? Those kind of things. And they asked physicians to write out answers. And then they asked their AI tool to write out answers. And then they blinded those and asked real physicians to grade them on 9 different dimensions of completeness and empathy and accuracy, all of that. In 8 of the 9 dimensions, doctors said that the AI tool beat their colleagues. And it wasn't beat them by a little bit, it was beat them by quite a lot. There have been a number of other studies now that suggest the answers provided by chatbots are perceived by patients and sometimes also by doctors as being both more complete and more empathic than the answers provided by real doctors to those same questions. And we've already heard about AI tools that can read X-rays and tell you whether there is a likelihood of, a significant finding, that can look at pictures of skin lesions and predict if they're cancerous. They can read EKGs, they can read pathology specimens. This technology is moving very fast right now, and in many ways it's very exciting. We've done a series of cases about AI over the last 5 years at our Aspen Ethical Leadership Program, where we have leaders from healthcare systems look at specific cases that have been brought to us of ethical issues that are facing their organizations. And I will say one of the themes across all 3 of these has been a concern that what is really driving the adoption of these and the promotion of these is not so much improving medical care as it is money. That should surprise no one. I'll just point yesterday to an article in Stat News about software for dentists, an AI tool that increases the dentist's ability to spot early tooth decay and therefore to propose treatment earlier in the disease process. Sounds great. There are 8 products like this that have now gained approval from the FDA, and there are several more on the way. How do you think they're being sold? They are being sold to dentists because they can provide an immediate payback, right? The dentist is going to catch more cavities, perform more treatments, and get more revenue. So they're arguing that early detection can maybe head off later root canals and implants and more expensive things, but there's not solid proof that any of that is happening. And the regulation of these tools in terms of their marketing is lagging far behind the claims that are being made. It's reminiscent, by the way, of similar things that are happening in other areas of medicine. So this isn't just dentistry. We heard about mammography, right? There is considerable debate about the relative value of even earlier detection of breast abnormalities that may or may not ever develop into cancer. But there is undoubtedly a revenue argument for doing more and finding earlier, because that means more and earlier diagnostic procedures. That's not necessarily better in terms of patient care. This is, by the way, a common issue across all screening tests, so it's not unique to AI, but it does raise this question of, what are the drivers of this AI revolution that we seem to be experiencing. And on the other money side, by the way, is using AI to prevent delivery of expensive services that the insurance company would rather not pay for. There was also an article just in the last week about insurers using predictive algorithms to pinpoint the earliest possible moment when they could plausibly cut off payment for Medicare patients who need long-term treatments. Those kinds of denials based on this proprietary AI algorithm are very hard to fight. Patients might not even know they're fighting against an algorithm, and they can't question the algorithm's calculations because it's a proprietary and or a black box algorithm where you don't even know what the factors are that are leading that algorithm to say, hey, you don't need nursing home care anymore. You don't need rehab care anymore. You ought to be at home. Those algorithms have been extremely profitable for Medicare Advantage plans because they're taking patients often who are quite ill, and so maybe they're going to die of their disease in 3 or 4 months. And the algorithm is being used to justify cutting off their benefits, forcing them into this denial and appeals process that can then last for years. So the appeals last longer than the patient does. And that is presumably the point, because that is a good way to make money, to not pay for services for someone who's about to die. I don't mean to be so blunt. Well, I guess I do mean to be so blunt, because honestly, this is the business case for some of these tools. So all of that said, there are also ways in which AI tools are being used to fight back against some of these, if you will, sort of nefarious purposes. AI can help with prior authorizations. AI can help with finding buried information in a dense chart. AI can help with avoiding diagnostic delay or anchoring, right? AI tools don't get tired. They are not traumatized by the last case that they saw. An AI tool could function as a tap on the shoulder to say, there may be something here you should have looked at. Do you want to take another look at this film? And there are ways for AI models to be used to help check our own biases. There's been a lot of talk about how AI tools themselves can hold bias. The real question, I think, is not whether an AI tool might be biased, but is it less biased than we are? And we are certainly biased. There's no doubt about that. So can AI be used to tap us on the shoulder and say, are you sure that this is the right thing to do for this person? So I'll close with just giving you the 3 cases that we've looked at over the last few years at the Aspen program. The first one was an AI predictor for readmission. This is kind of an infamous case. It ended up published in the Annals of Internal Medicine. But this predictor tool looked at patients who were being discharged from the hospital and was supposed to maximize revenue by preventing readmissions within 30 days, because you get penalized if you're a hospital and a patient gets readmitted within 30 days of discharge. The tool was a black box, so we don't know what exactly it was looking at. But when people at one of the universities using it had a group of doctors who said, I refuse to use that tool, it allowed them an opportunity to compare those who were using the tool against those who weren't, sort of a natural experiment. And what it looked like was happening is the tool was actually diverting resources to people where it was most likely that those resources would actually prevent a readmission, which means diverting resources away from people who could potentially really use additional resources. And let me be very clear. What this meant was that white patients were getting more resources upon discharge, and Black patients were getting less additional support on discharge. We don't know exactly why, but it could be because the AI was built to maximize revenue, not to prevent all. It also, by the way, turned out that using this tool caused a slight bump in readmissions right after 30 days. So it was doing a good job at maximizing revenue. It was not necessarily doing it in ways that we all would think are sort of morally and ethically acceptable. The next case we looked at was a chatbot. And chatbots, we did this in 2022, not to brag, but we were before ChatGPT. We were looking at this because we could sort of see what was coming here, that chatbots were becoming increasingly powerful, and the next generation might actually be able to interpret a patient's question and formulate in a reply in a way that would be indistinguishable from a human reply. So these AI tools, as you all know now, because of ChatGPT, are intended to mimic real human conversations. And there are studies that have shown patients using a chatbot are sometimes more likely to disclose their sensitive history and emotions than they are when they're talking to a real human being. On the other hand, in a recent review of 78 different apps that are chatbot type apps, only 10 of them these are apps you buy on the App Store, but only 10 of them were compliant with HIPAA. Now, they don't have to be compliant with privacy regulations because they're not delivering healthcare or they're not covered entities. But that is concerning to a lot of people that, we're seeing these tools arise in unregulated spaces outside of the healthcare system. And of course, you all know now that there are well-known problems with chatbots, including ChatGPT, they may not reliably interpret some human statements, which, by the way, because they don't always pick up on emotional cues and context, which, by the way, a lot of humans also don't pick up on emotional cues and context. But specifically, there have been chatbots that have failed to respond appropriately when a patient has typed in, a clear signal of possible danger, like, I want to commit suicide, and the chatbot responds in a very inappropriate way. Chatbots also are well known now to make things up. The tech giants have called this hallucinations. That's a very kind term. You could also call this, if you were, looking for a metaphor to human beings, you would say these are entities that can lie with a perfectly straight face, right? They have no compunction about lying to you about something. That is a problem with these AI tools. There are also a number of worries about legal liability. If a chatbot makes a mistake, misadvises a patient, is that clinician responsible because the clinician allowed the patient to talk to the chatbot? Should it be the company that made the chatbot? Is it the health system that purchased the chatbot and installed it? Is it someone else? It is all of the above. This is, open space right now. Although I will say the chatbot creators, by and large, have excellent lawyers. And so they are doing their very best to ensure that if a chatbot makes a mistake and someone gets hurt, it is called a glitch and not a medical error. What happens if a chatbot gets hacked, right? Those kinds of things. Rachel,
yeah, sorry, I don't mean to cut you off, but I just want to make sure we have time for questions for our audience. So
yeah, well, why don't I stop there? I don't need to talk about the DERM tool. You already mentioned, Rachel, the issues of a tool that can look at a picture. That this is the case that we looked at this year, and these tools are in fact racially biased. They are also in that they are a little less accurate with dark-skinned patients than they are with light-skinned patients. That's for a variety of reasons. And, they're working on it. They will probably get better. Right now, they're already better than most primary care doctors, who are also worse at diagnosing dark-skinned patients, lesions on people with darker skin than people with lighter skin. And that this has raised this sort of Pareto optimality problem of, if all the boats are raised, but the boats of the rich people are raised even more, then the boats of, the yachts get raised more than the rowboats. But everyone's raising up. Is that, an ethical approach to quality improvement?
yeah, for sure. Definitely an important question to consider, like with the implementation of these algorithms, it's not as simple as, they're biased, so we should never use them. There's also biases existing in our system. So I want to go ahead and transition over to answering audience questions from our panel. Before we do that, I wanted to mention that, this topic is a lot to squeeze into 1 hour. And I know we're gonna kind of hardly scratch the surface today. I did want to mention that I am pleased to tell you that, this is for the Colorado Health Institute, and hopefully for all of you, this is just the beginning of, the AI conversation in this space. We are hosting a conference this year on December 1st called Hot Issues in Health. And our keynote speaker will be Dr. Nita Farahani, who is a leading thinker on artificial intelligence and neurotechnology and the intersection between, privacy and rights in that space. So please look out for information about our Hot Issues in Health Conference, which is, the registration is open now. And we hope you are able to join us for that continuation of the conversation and also further continuations in the future. But with that, I'll go ahead and kind of open it up to questions. If you'd like to come off of mute and ask a panelist a question, go ahead and raise your hand. I see we have a couple people with their hands raised. Why don't we go ahead and bring Daniel off of mute so he can go ahead and ask our panelists a question. Okay, so we have Danielle, who has raised her hand. So Danielle, you can go ahead and come off of mute and ask our panelists your question. I think we might have to switch to another person. Can we go ahead and switch to Daniel? Okay, Daniel, you are able to come off mute and ask your question.
Yeah, well, you asked me to expand a little on one of the ways to bring diversity into the AI field is the fact that you're going to have to, increase the pipeline for the development of AI for marginalized populations. It's a topic I've talked about. I have my paper there. The fact that data is not neutral in many respects, and I talked about it. I am a Latino. I worked for Children's Hospital Colorado and for Colorado Department of Human Services, and diversity in all these areas has always been my concern. And one of the things I could speak about, given my background, and one of the fact of being able to spot these initially when you talk about it is you just have to have people at the table. And it does, because we all have our blind spots, and that's one of the things I talk about in presentations I give. I have my blind spots. I worked with the LGBTQ plus community because I had a blind spot there in one of my presentations. And they need to be at the table at all levels, not just at, I would argue, not just at the community level, because they don't understand all the implications. Because even starting when I think of AI, split into three things: data, the model itself, and then the output, what it's really doing. And understanding training sets from the very beginning and what they are and what they represent. You can see that with facial recognition. Why did facial recognition fail? Because the training sets were all white male of a certain age. They were trained to identify those. They weren't really trained to identify anyone else. That's why they were failing. And AIs don't have a failure mode to say, we can't do it. They'll try to do it regardless, which is one of the issues. But that's where I wanted to talk. And, I've always spoke out against is like part of the conversation that's really missing here is how do we drive that pipeline? Because just involving the community at the back end, it is just not going to help. They need people who really understand data, what goes into the creation of a model, and even the output of a model, and the policy and the privacy. I'm a privacy engineer with a law degree, with a technical background, engineering background. And I deal with this now, and I'm kind of actually starting to do some pseudo audits of AI systems. So that was my input, and since you asked for it. And like I said, I have those. I have a paper there that discussed a possible AI review board for healthcare systems, combining the best of data review boards and IRBs. So thank you.
Yeah, thank you, Daniel. We really appreciate when people are able to come and share their work and their perspective and some resources. So yeah, definitely appreciate all the points that you're raising. It's super critical, like you say, not only to involve a community in kind of the process, but also to cultivate a workforce and to share technical knowledge among all, different types of people, especially people who have been historically excluded from those types of fields, like due to all the barriers with, education, workplace, etc. So thanks for bringing that up. I'll pull one question that we have, or actually, let me give you a chance. Nina or Dr. Wainia, did you kind of have any comments to add on to Daniel's point?
I'll add, we don't have time to get into it today, but I am so appreciative that you're bringing this up, Daniel. there are a number of national initiatives that are looking to increase diversity and inclusion in STEM and STEAM, specifically around AI. I also think there's a point to note the learning and development of regulators. There's a lot of initiatives, some that I've led at the federal level, where introducing 101s, introducing opportunities for folks to learn and build together before starting to regulate, because there's a disconnect of wanting to regulate but not knowing what's going on.
Yeah, absolutely. And unfortunately, Dr. Nwania has to dip out a little bit early. So are you having to leave now, or?
I will probably leave in about 3 minutes. And I don't have a comment except to endorse what Daniel's talking about and that Nina has amplified. There is an enormous need, and I think, Rachel, you brought this up as well. There's an enormous need for community engaged AI work. And it's challenging for a variety of reasons, starting with the fact that it's, very technical. This is, I was never bad in math or science. I have a hard time with some of this stuff. It is extremely challenging. It took me 2 years to figure out that black box algorithms really are black boxes and why that is. I sort of made the assumption that like multivariable models of various sorts, that you could figure out what was going into the algorithm if you really wanted to. It turns out that's not true. There are actually algorithms where it is literally impossible to determine what is causing the algorithm to predict X, Y, or Z. So anyway, I think there's challenges with getting community engaged, and starting early and building a pipeline of community members who have some level of AI literacy is going to be a task for us, and we need a diverse community with AI literacy, right?
Yeah, absolutely. Before you go, we have one more question for you, Dr. Wainia, which is Monica is asking, is there a publication or public available study about the readmission tool case that you mentioned? Or where could people go to find more
I
information?
want to say it was in, I think I said Annals, but I think it was actually in Science. I will see if I can dig it up. What yeah, Daniel, good, excellent. Daniel just pointed in Timnit Gebru and her experience with Google. Engaging the public in these conversations is not always to the immediate financial benefit. I think it would be to the long-term benefit, but it's not in the short-term financial benefit of these companies. And Google, despite having as one of its core tenets to not be evil, is still a profit-seeking organization, and they do what they can to avoid conflicts and public embarrassment.
All right, well, we'll be sure to share the resource to that study out in our kind of like follow-up email with the webinar, to make sure that everyone can be able to like check out the study on that use case. But with that, I think we'll let Dr. Wainia off the hook. Thank you so much for joining us.
Great to see you this morning.
And we're going to wrap up just a little bit early today, but we still have 5 minutes for questions. So please feel free to raise your hand or to put more questions in the Q&A. Oh, I see we have somebody with their hand raised. Can we go ahead and bring Seth on? Okay, Seth, you are up, and so you can come off of mute and ask your question.
Very good. I think it was a great session today, and I appreciate the presentations. But if you really take Matt Wainia's points to heart, this is not a technical question, so long as all the incentives in healthcare are basically based on investor incentives. That is to say, producing more unnecessary care, denying necessary care, charging more whenever possible. Until those incentive systems are changed, I don't think addressing the future of AI from a technical perspective is likely to be very successful. Sorry to introduce, people accuse me of being unrealistic when I talk about the capitalist formation of healthcare in the United States and our need to change it. But I think we also have to realize we're being very unrealistic if we don't confront it head on and start looking at socialized delivery systems.
Yeah, thanks for raising
Sorry, that wasn't really a question. It was just a rant.
Yeah, no worries. Nina, what are your thoughts on Seth's point?
Seth, thank you for standing up and sharing that. I would like to highlight that there are some conversations and work happening, and CHI is part of these in the value-based care movement. The state of Colorado has committed to prototyping and piloting value-based payment transformations, which I think start to connect to your questions and concerns. When we start to explore how to maximize the value-based care conversation through the payment reform, we might start to see different outcomes. So I would encourage you to have hope and track and follow the work that we're leading with the value-based payment reform. And the state of Colorado is doing really wonderful work, HICPUF specifically. So shout out to anyone from HICPUF who might be on the call today. Thank you, Seth.
Thanks, Nina. Another question that we have from Sharon in the Q&A is, do you think it will aid, AI will aid in predicting the impact on policy initiatives? I'm thinking we can predict the impact of policy before and less reliance on evaluation, which is always lagging behind by several years. So I guess thinking kind of broadly speaking in the healthcare and health space, like could we use AI to help guide our decision-making on policies?
I can add a comment to that. There is a motion, particularly in the clinical trial space, where I was coming from in real world evidence. So finding ways to unlock more rapid insights from humans, whether that's patients or care teams or different kinds of providers who are working on the ground. I think there's a big conversation there. We could have a follow-up as well. The use of synthetic data as well is interesting to note. And if we want to truly understand population health, might we create more representative data sets? And again, that could be a whole separate conversation. Thank you, Sharon, for asking.
Yeah, that's a great point, Nina. So kind of, yeah, well, one capability with like our modeling abilities, I guess, is that we don't necessarily have to test everything on real humans, right? We could potentially create, simulated environments, simulated results. And of course, those have plenty of limitations within themselves, but that is certainly an element to testing AI, right? It doesn't always have to be on real people. Well, I know that this conversation probably feels short today. Again, this is a huge topic, and we really appreciate all your participation today. We are needing to wrap up just a little bit earlier, so I'll go ahead and kind of close off the questions for today. But again, thank you so much for joining us. Thank you to my colleague Nina and Dr. Wainia, who left us a little bit ago. Again, if you're interested in kind of continuing this conversation, go to our website or check out the links that we dropped in the chat related to our Hot Issues in Health conference, where we'll have our keynote speaker actually speaking to the issues of artificial intelligence and neurotechnology. So with that, I hope you all have a great rest of your day, and thank you so much for joining us.